thank you so much to all of these extraordinary individual leaders in our community here in Western New York and here in New York State. We are in unprecedented times here, and this is a time where we all need to come together more so than ever before. As a lawmaker, it's my job to make sure that I'm supporting the efforts that are happening on the ground. And we are informing the decisions in Albany based upon the needs of our community and across the state, communities that are just like ours. As you know, I'm a sponsor of a bill 8717A that would require an equitable distribution of the vaccine in New York State and really prioritize the vulnerable communities, those that have been most disproportionately impacted by this virus. This bill is crucial to ensuring that more lives are not lost and that we're not leaving out those communities that have been most impacted. That would include the Black and Brown communities, those with pre-existing conditions, seniors, as well as essential workers, and so many more. As someone with a background in a health profession, I'm actually an occupational therapist, I recognize the need to really put a focus on the vaccine and addressing this virus aggressively as much as we can in our community as the vaccine is rolled out. So we wanted to bring everybody together here today, listen to you, hear from the experts, weigh your thoughts on direction and where we head here, not only as a community, but as a state. I'd like to bring Dr. Raul Vasquez into this conversation. Dr. Vasquez, if you could talk a bit about the work that you've been doing on the ground and your thoughts on messaging regarding the COVID-19 vaccine and our work that we have in that regard.
Well, I think for us, it's, we see the county and the state doing great things at the hospital level, but it's got to be a grassroots approach. And I don't think we do enough with the doctors in the community, which are, especially like some of us, we're the only ones that are really serving a lot of this community. Lack of primary care is something that, even though we talk about vaccine, it's real important. I think, some of the zip codes that are being affected, like the 14215, have considerable amount of resources being deployed to those hospital structures right around there, and we're not seeing any impact. I think, you have to lead by example. And, myself and Myron will actually, when we get the vaccine, because, we're towards the end of the line instead of some of the doctors online got already the vaccine. We don't have that luxury. Is the fact that, I hope that Dr. Anusari will join us and also showing people that, we've done the research, we've done the science. So I'm a physician. I've been doing this for 30 years. And all I can tell you is that we've been given vaccines for the last 30 years. And the individuals that really need to play a more active role are the ones that give these things. We know the side effects. We know when people have reactions. And we also know how to, tell the people, give them the right information, because health literacy is really huge in our communities. And there's a lot of fake news that just goes around. So, we do surveys. I've already done surveys within our staff, because if I don't have ambassadors within my staff that really want to take this shot, I don't know how I do the community. So we really have to look at that. The disease is not going away. We don't have any real treatments for the disease. So it's so important that the vaccine becomes a tool in how we manage this population, just like we've had the flu. And I find that this vaccine will be like a measles and a varicella vaccine. So when you get this hit, the 2 shots, you built your antibodies 2 to 3 weeks later, that may be it. We may not have to go back to year after year like the flu, which is completely different types of coronaviruses. So I think the awareness is going to be important. I think the grassroots distributions are going to be real important, but the data is real important. Where do you should start? And I think you look at the areas that have been affected the most and really follow that approach when we're going to do this, using different types of infrastructure. We have a bunch of food trucks that are parked. We can provide food and get people vaccinated, but work with systems that are already working. So when, Anasari's group, my group, Myron's group, we give shots. I mean, we give about 500 shots a month, minimum. So that data gets put into electronic records and automatically gets uploaded to the state within 10 seconds. I mean, because we have a bi-directional setup. So I think that is going to be real important if you really want to know who's getting these vaccines, and if you have a reaction, to be able to target it and really have that type of infrastructure. But you have primary care infrastructures that are in place that do a lot of public health that I feel are often left away. So while you have health department, while we have the university, that's all great. These guys aren't out here. They don't know what we do. So it's easy to kind of talk about it, but I want you to come and see the world we deal with when you may have a house that has nothing, no food, nothing. And so how do you get someone to come out and really focus on getting these vaccines? And I think that's where there needs to be a little bit better focus, because we lacked in primary care physicians, we lacked in chronic disease, and all these social determinants of health that develop. The virus is just kind of not going to, if we don't do this, and I've said this before, and we don't move the people on the front of the line that should be in the front of the line, the second quarter of 2021, we're not going to be any further than we are now. I mean, this will push out to 2022 to be able to get that, because if 70% of the population is not vaccinated, if we still don't follow the precautions of, social distancing, mask, hand washing, this is not going to change very much. So it's in the best interest of the state, it's in the best interest of this government to make sure that we educate and that we really get out into these communities and really have ambassadors. Like, I'm hoping Dr. Anasari will join me and get that shot. And Kennedy, that would be nice to have you, Senator, there too, because if we show the rest of the world that it's the right thing to do, I think it's going to be important. So me and Myron we're going to be the first once we finally get this. The Pfizer, I don't think the Pfizer's practical to our offices because of all the storage craziness and the draw on the pharmacy. I think the Moderna, which hopefully gets approved today, will actually be the one that has a better shelf life and actually a better delivery system for our community. And I feel that the stats on that one are actually better. I talk to people, and some people don't even get the flu shot. And, and if you don't have the flu shot at this point, it's a double whammy. And it's so important for people to not be so scared of some of these vaccinations, because, like I said, we vaccinate. I'm not, and I think what happens, and it's going to happen in our community with Black and Brown, not in my office, but they happen, where if our community is misinformed, they're going to refuse. And that's so easy to kind of document. Patient refuse. They refuse a colonoscopy, so they died of colon cancer. They refuse a mammogram, so they died of breast cancer. I don't agree with refusal. And our value-based models are, in terms of improving quality, Urban has some of the best qualities in the state, and it's reported. And it's because we don't allow patients to just say no. We try to get them informed and to make sure they make the right choices. But refusal is not a language that we like to use at Urban at all.
Thank you again, Dr. Vasquez. We certainly appreciate your leadership.
So our first question comes from Rita Hubbard Robinson, and she asks, what are the side effects of the COVID-19 vaccine, if there are any, if some of our doctors could weigh in there?
You want me to raise my hand, or? I mean, the biggest thing that you have it's similar to the flu shot. So if you got your flu shot, some people are going to feel like they got punched in the arm. So you really want to get the vaccine. If you're left-handed, get it on your right hand. Some people may get mild symptoms in terms of a little bit of a fever overnight. Malaise, just muscle aches. And in some cases, and since we know the patients that we're giving these shots to, if they have really bad allergy reactions, you really got to be you got to watch them a little bit more. So if they get the shot, have some Benadryl and some Epi, something, just God forbid something goes wrong. Doesn't always happen, but I think if you're prepared, you end up running. That's pretty much what you see. In some cases, if some people have local reactions, the area may get inflamed, and that requires, and sometimes we have to put people on some steroids. But that's the gamut of what you're going to experience. And likely, most of the time, you're going to feel a little bit of sore, and that's it. I would say about 85% of the time. If any of the other one of the doctors want to comment.
Yeah, that's a nice summary. I would also just simply add that these kinds of reactions, a little bit of low-grade fever and fatigue that some people feel and so forth, and muscle pain, that's part of the normal reaction of the body. That means you're making an immune response. In fact, I heard one person describe they were in a clinical trial, and they didn't know if they were going to be in the placebo or the vaccine group, and they woke up the next morning and they had some muscle aches and a little bit of fever, and they said, yes, I got it. I got the vaccine, because that is really what you expect, even though everyone doesn't even get that, and you're still making a good immune response.
No, and the last thing too is on the second shot, the reaction will be a little bit more. You'll see more of it, because with the first set of shots, what you're doing is basically priming the body, and it's creating what are called memory cells. The second time, those memory cells fire, so you get more of a reaction, so that with the first shot, they'll know. And I think it's real important to educate them what may happen on the second shot. And also, which I find, and we didn't talk about, it's the scheduling. If they get one shot, they may be 70% covered, which in some trials say that's okay. But to get them coming back for the second shot, in offices in the inner city, very difficult to do. And you're basically having to chase people. So when you get them, we have to really create a sort of a plan so that they know how important, and really we can get back to them. We haven't talked about that, but that's going to be important. The other thing is, if you had COVID, you still need the shot. So I don't want people to think, well, I had COVID, I don't really need that shot. And that education needs to come around.
Perfect. Next question comes from Melissa Archer. And this is specifically to Dr. Leslie. She asks, from the research, how long does the vaccine protect? Is it up to 12 weeks, 4 months? And if so, is it going to be like a seasonal vaccine that people will have to take?
I think we don't really know. As Dr. Murphy said, the vaccine trials started in late June of this year, and we're only 5 months from the beginning of the trials. The vaccine produces a brisk immune response, and there's reason to believe that it may be longer lasting than even having the natural disease. But right now, we really don't have all the data, but the height and the strength of the response from the vaccine seems to be excellent. And it's very different, as Dr. Vasquez said, very different from influenza, which changes every year. This virus is a little bit more stable, and we don't anticipate that same, what we call antigenic drift over time.
Perfect, thank you. Our next question comes from Francesca Messiah. She actually asked, is there a list of the side effects and COVID-19 vaccine information being provided to our immigrant population?
I don't know if it's being provided directly to the immigrant population, but it is available on the web. You can pull up the side effects from both the Pfizer site and very shortly from the Moderna site when the FDA approves it. And as the other panelists said, it's mainly fever, aches, and pains. And I agree with Dr. Murphy. I actually, like I said, I just got mine. I was lucky enough to be able to get it through the hospital. And I actually hope that I get some mild side effects, because I think that means that the vaccination's working.
Awesome. Next question is from Linda Ogden. She asks, is there one COVID vaccine that is best for seniors?
So we don't know is the honest answer right now. We do know that the data from the Pfizer vaccine, which is the one that's out now, and the Moderna vaccine, which is likely to be approved very soon, is just as effective in seniors. People over the age of 65 is what they use as their cutoff, as it is in the rest of the population. So we don't have data really on the other ones just yet.
All right, got it. We have a question from our media. WKBW is asking, Catholic Health said one of its first steps as the vaccination hub coordinator will be creating a healthcare equity task force. Have any of you been in talks with them to be on that task force? And what would you like to see that task force accomplish?
I'll jump in on that one. They don't need to do that. I mean, that's the kind of top-down thinking that, infuriates people who are on the front line. We've been operating as a task force for 5 years. We've been doing work out here in the community. You got people like Dr. Vasquez, you got people like Dr. Ansari. We've made a broad coalition, Zanetta. So they need to make one phone call, and we'll work with them. But sometimes, and let me just say it, I don't know this, but a lot of times people pick community folks they want to work with, as opposed to the people that are already working with folk in the community. So I would say to Catholic Health, they don't need to create anything. We would be more than happy to work with them. We have an infrastructure. We've made over, how many phone calls, Dr. B? Over 100,000 phone calls to people in the community. So maybe I don't want to step on anybody's toes, but that kind of stuff it just baffles me, that I think it's arrogant, and it's just not helpful. So we would be really willing to work with them if for the benefit of the community.
I have a strong inclination, Pastor Nicholas, that you'll be hearing from them. And, look, this was just announced yesterday, so I think everybody's trying to get their feet underneath them and try to figure out which direction to go. It's a perfect fit for our regional vaccination distribution hub of Catholic Health to work with the Health Equity Task Force and the Health Equity Institute on implementing this in the community, as well as the faith-based leaders. And that's something that we're actually doing outreach on to the Catholic Health leadership on. Actually, today we sent a letter out. So we're looking forward to communicating with them and making sure we have that line of communication that we all know that we need between the community and those that are providing this vaccination. I think another note that's important that Fran Messiah brought up in her messaging was about the language diversity of the messaging that we're getting out there to the immigrant population, to the community at large. We know that we have a very diverse community. We know we have a growing immigrant population as well in the city of Buffalo that has brought up our population and really played a role in the growth of our community. But with that, we also know that there are great obstacles in the communication from the various agencies and health departments, not only at the federal level and the state level, but even into the local communities. So I think that'll be essential as well to help to inform the public by creating a wide variety of languages that are addressed in the messaging regarding the virus.
Yeah,
So,
but this is Dr. Vasquez. The thing here is that in September, there were care dollars given to the county. And in September, that was for a vaccination deployment plan. And it would have been nice if you have all those resources, to reach out to a Myron that has his Burmese population. That's really the hotbed of the area, We have it in the black population and the brown population with Latinos. So that none of these entities were really included in that model. So you got federal money, which is, as a taxpayer, it's federal money. That really needs to apply. And if it's set up for a vaccine distribution plan, that was in September. We're in December now with the deployment, and yeah, it's all nice, but the communities, there's not a lot of translation. You have these morning reports, and that's it. Sign language, that's it. There's no English, Spanish, Arab, Burmese, other groups that if we really have an impact. Because again, they're our brothers and sisters. If you leave them behind, we're going to still be in this situation at this point.
Hey, Senator, it's Skylar Banks. We have documents in multiple languages that the state has, and we have them in electronic files. We've passed them on to your department, and we've been passing them on to the organizations that we've reached out to. So if anyone needs that information, we have multiple documents in different languages.
Yeah, that's excellent. And I think getting that information out to these various leaders, that'll be essential. So we'll work with you on that, Skylar, as well as Madeline. Thank you. Back to you, Zanetta.
Yeah, so our next question is from Rita Hubbard Robinson, and she would like Dr. Leslie to explain why he has already received vaccination.
Yes, I consider myself extremely lucky. I take care of patients at the VA hospital, so I do infectious disease consultations, and I see many of the COVID patients that come into to the VA. The VA is a very special population to me. I've been there for over 30 years, and I really would like to echo what Dr. Ansari said. It's my responsibility to listen to the patient and try and make sure that the message that I'm giving them is appropriate and understandable. I'm at the medical school in the curriculum office, and I tell the students we'll teach you over 10,000 new words in medicine, and that 10,000 new words, it's a totally different language, and I have to make sure that I'm speaking a language that everybody can understand. So I was very lucky because I have worked with the patients that I've been able to receive the first immunization, and I'm scheduled for January 6th for my second one.
You know, I would add that the New York Times has a website, and you can go to it, and you can put in your age and so forth, and they'll tell you where you fit in line. So I've not gotten mine, and I'm number 23 million in line, according to the New York Times. You can also choose the county. I'm in a little bit better spot in the county.
Thank you, Dr. Leslie and Dr. Murphy. Our last question is actually to each of our panelists, and that comes from Francesca Messiah. And she asks, what is your one line that you would use to encourage people to take the COVID vaccine?
I'll go first. During the time of this town hall, 120 people have died in the United States. So the vaccine is going to be our path to the end of this devastating pandemic that we're all suffering from.
Get information from people who are working and serving in communities in which you live. That's where you should get your information.
I would like to speak. I guess I would say we're boots on the ground, and we can really truly see that this truly is a matter of life or death. Choose life.
Dr. Vasquez, it's, right now we have no real treatment for COVID. I mean, we treat the symptoms. And I find that if we get educated, and the trials are showing that, the individuals that were vaccinated, if they do get COVID, it's a milder form of COVID. And I think it's going to be real important, especially for families. So it's going to be, the choices you make will affect your family. And I think in some of our communities, not getting vaccinated means that more will die. And, we're almost at 1,000 marker here. I don't want to be part of that 1,000 if I can. Just for the record, we have 15,000 lives that GBON and Urban carries, and I only have one death and all that, and we had a lot of people with COVID that tested positive because we were running our stats. But it's just how to educate people, and if they do get into trouble, getting them out of it. Chronic disease management, it's so important. So with the contact tracers, I need for you to make sure that these people are taking their antihypertensive, are taking their inhaled steroids for asthma, are taking their insulin, because by doing that, they're protecting themselves by reducing the amount of receptors in their lungs so they don't catch this infection. So good chronic management of chronic diseases is really crucial to what we do. But at the same time, with primary care, and I'm a family physician, primary prevention vaccines are crucial. We've eradicated smallpox. I mean, most of this year is not only going to be bad for COVID, but we haven't been able to vaccinate all our kids as we do. So we will see rises in measles and varicella and and all these things that we have eradicated because people are getting vaccination. And urban immunity does work, but we have to vaccinate. So I really push people to think twice. You know, the disease will kill you. The shot won't.
Senator Kenny, this is Pastor Blue, president of the Buffalo NAACP. And we've had the privilege today of having both our co-health chairs, Francesca Messiah and Sonia Melvin, on the call. And we want to be a vital part in helping to spread that information and that message and to share with the diverse population that we serve with the NAACP. But my one-liner is, choose life.
Very simple. Thank you, Pastor.
I would just say that everyone has said pretty much what I would have said. However, I also would all add that until we all can get a vaccine, we are to follow what God has already put in us for prevention, which is the hygiene. Social distance, wear these masks, and wash your hands. So until then, we still, because the vaccine, the disease is not going away with the vaccine. So we want to stay vigilant in what God has already given us to prevent this until we do get the vaccine, and we still have to work together. So the more we learn and the more we get to work together, we will work together to save our communities.
I mean, I would probably say that the vaccines that are currently available and will be shortly available are the result of worldwide research against a global pandemic, the worst that we have seen in over a century. And this amount of science, resources, and technology has produced a safe and effective product that should save the lives of countless people.
Hey, Senator, I'm a military veteran, and I'm out here doing contact tracing work, and I have to lead by example. I can't preach this stuff and tell others to do it unless I'm doing it. That's mine.
Thank you. And thank you for your service. Anybody else?
Lastly, I would just say, as we wait for the vaccine, to just protect your community, family members, and friends. Do your part in society. Once again, just wear your mask, wash your hands. We can fight this thing if we just work together.
And one other thing, even though I've been lucky enough to receive the vaccine, I still have to, and everybody else will still have to, continue to wear masks, continue to social distance, and continue to have proper hygiene. There's multiple reasons for it, but to me, the most social reason is there's nobody on the street that knows that I've been vaccinated. I'm not going to be carrying around a little sign that says I've been vaccinated and my titers are high. I mean, it's the socially responsible thing to do, and we don't know right now whether it decreases the carriage of the virus itself. It clearly protects against disease.
All right, thank you all very much. I just want to say thank you for participating today. This was amazing. I think that our community is a little bit more educated on the facts of the vaccine, and I just want to say that to the public that this won't be the last of these types of talks because we think they are so important, and I will pass it over to the Senator to take us home. Thank you.
Yeah, thank you, Zanetta. Thank you for helping to organize this and always for your leadership in my office and in the community. Again, I'm blessed to have Zanetta Everhart as my Director of Diversity and Inclusion in the office, but really just a magnificent advocate and leader in our community. So thank you, Zanetta. And to each and every one of you panelists, I'm really so honored that you've taken the time out of your extremely busy schedules to join us here to help inform the public. We really had a wonderful conversation. And to Zanetta's point, this is far from the last. You know, when I've been talking to my staff about our work, I've been discussing the fact that when this pandemic hit, it hit all of us first. It hit us here in New York the hardest, and we were all playing catch up from day one. We didn't see it coming before it was upon us. And so, you know, from our perspective, we were playing, all of us collectively, we're playing triage in a lot of ways and how to address this. And after the first 2 or 3 months, and we've become accustomed to dealing with all of the ins and outs and nuances of keeping ourselves and our families and our neighbors safe while trying to continue to move our economy forward, we've been maintaining at that level, waiting for the vaccine. Now the vaccine is here. Everything we are going to be working on from here on out is going to be how we can get that vaccine to the public that want it as quickly as possible, to the public, especially in the communities that have been so disproportionately impacted by this virus, as quickly as possible. And it's through your leadership, the work that you've been doing, not only through this pandemic, but before this pandemic even hit us. All of these panelists have just been exceptional leaders, and I'm just so proud of our work together. But I really want to thank you on behalf of our community, on behalf of the state, for everything that you continue to do, but really all the work that you're doing each and every day to protect our citizens in Western New York and in New York State with your work on the front lines.